Hello, this is Dr. Marsman from Complete Injury Centers, and we have discussed the lower back pain in previous videos, and you can refer to those as well. But as we mentioned before, lower back pain could be caused by many different reasons, and the issue that we are going to be focusing on is when the patients come, which we see that very often, is that patient is complaining of the lower back pain in this area right here and in the groin area. And patient complains that when I try to get up, it is hard, and bending forward, it is bothering, and also laying down on the bed, and when I have my legs straight, it is difficult. Getting up from the bed is also not comfortable, and all of those again could be because of the multiple different reasons, not one, or it could be a combination of a bunch of things. But one of the major cause of having the lower back pain as well as the groin pain is because of this set of muscle right here. Is called iliopsoas muscle. It is made of the psoas muscle right here and the iliacus muscle right here, and you see that both of those are attached to the femur of the hip bone, and it is attached to the medial side of it. It's called the lesser trochanter. It's just a name, and the function of the psoas muscle is bring the hip forward like as such, and also is going to push, as you see that, here's the muscle right here, as you see that it causes the lower back spine, lumbar, to push forward. So it's going to increase that curvature of the lower back, which is called the lordosis. So if this muscle is tight, it causes the tension in the lower back deep to the abdomen. So if the patient said, well, it is not right here, it's deep into the belly. And also they're going to complain about the area of the groin area that is tender, and it is painful. And again, we will talk about that issue of other possibilities of having those kind of symptoms on the PowerPoints. But what we are trying to do, showing this model, is that you can observe and see where these muscles are. Beside the psoas muscle right here, we have the iliacus muscle as such, and the iliacus muscle, it is not attached to the vertebrae. And this iliacus muscle, what it does is only flexion of the hip, so it's going to be as such. So the psoas muscle is more complicated muscle, and has more connections to the spine, and it has multiple functions. Again, we'll see more of that in the next section, which is going to be the PowerPoint presentation. Hopefully you will enjoy it. Hello, this is Dr. Marsman from CIC Complete Injury Centers, and today's topic is the iliopsoas muscle and back pain. And as we discussed that earlier in this video, the back pain it can be associated with the multiple different causes, and today we're going to be focusing on the iliopsoas muscle, how that can contribute to the lower back pain. And here's the lower back pain, and we have experienced that, or we have seen people they have experienced that, and it is not a very comfortable thing. And the lower back pain can be, as we said, can be caused by multiple different things. And one of the things that can cause the lower back pain is the posture, that how you hold it, where you're sitting, standing, and the seeing the screens, and if they're not balanced and adjusted to your height, then that cause also issues with the lower back. And these are those examples of that. And but today we're going to be talking about the lower back pain associated with iliopsoas muscle, but also these type of patients, they are complaining of pain in the groin area. And so if that is the case with the lower back pain, the groin area, and you're looking for one simple cause of that, and that cause both of those, that would be the iliopsoas muscle. But again, different things, different issues can cause a lower back pain or the growing pain at different times, in different way of presenting themselves. Let's review some of those. Here's the lower back pain. People, they have the disc issues, the herniation, and that is very common thing that we see that in amongst our patients that they are in the car accident, auto accidents, the sport accidents. And again, aging is also the one of the possibility that this can be injured. The cancer is something that we always have to consider as the possible cause, and so therefore we have to be careful about that one. And again, kidney stone and one or multiple can cause the lower back pain, and the muscle spasm and pain. The lower back has many types of muscles that can be irritated and can be painful. And again, there are visceral organs, referral pain, and like your stomach, intestine, colon, and pancreas, and kidney, and everything else can give the referral pain.